Now turn attention to Cross River State, where the Commissioner for Health, Egbe Ayuk, has announced a new case of Mpox in Obudu Local Government Area, increasing the state's total case burden to 5. The person is female from Okoshe village, and state authorities are investigating her travel history, including a recent trip to Ebonyi State. To mitigate further spread, the State Ministry of Health has activated the Incident Management System, promising thorough contact tracing and public education on preventive measures. Cross River State has a history of monkeypox cases, with 4 cases reported in February and March.
A sample was taken and sent to the National Reference Laboratory, and the result came out on Saturday positive for Mpox. So that is the first case we're having in this current outbreak period in Cross River State. Children are the target in this current episode, where 70% of cases are children under 10. So crowded, schools, environment are very important areas to implement prevention measures.
This current outbreak of Mpox, we received the result on Saturday, this last Saturday, 24th of August. So that is why the EOC, Emergency Operation Center for Response, have been activated by the Honorable Commissioner for Health.
Let's talk about monkeypox, especially in Nigeria. An epidemiologist, Dr. Egbe Ayuk, joins me from Calabar, the Cross River State capital. Good to have you join us, Dr. Egbe Ayuk. What really should we know about monkeypox? How is it transmitted, and what are the symptoms?
What you should know about Mpox?
Yes, please, Dr. Egbe Ayuk.
Okay, so Mpox, as we know, is a viral zoonotic disease. Zoonotic means we are getting it from animal to man. So it is caused by monkeypox virus. And there are 2 types of the virus, clade 1 and clade 2. So what is really affecting us in Africa and Nigeria mostly is the clade 1 type of the virus. And then it's transmitted to human by animals, and then it can come to human from human through close contact. And it can affect human also by close contact with contaminated materials like clothing, sharing of the sheet, towels, and post-sexual intercourse.
All right. And what are the symptoms? How does someone know they have monkeypox?
Okay, Mpox, that is what it's called now. Mpox has an incubation period of about 5 to 21 days. It can occur before that time, depending on the immunity of the person infected. So first, the person will have fever. There will be swollen lymph nodes. The lymph node will be swollen, indicating there's an infection, ongoing infection in the body. And then there will be chills, like cold. The person will feel cold sometimes. We'll have muscle pains. We'll have back pains. And this will follow by a characteristic rash. When we say characteristic, means the rash begins from the face and then it spread to other parts of the body, mostly the palm and sole of the hand and the feet. And then the rashes is like blisters filled with pores inside. That's characteristic of monkeypox. Blister that have pores inside it. And then with time, maybe 1 to 2 weeks, these blisters will dry up and then start up. So that's how you suspect that this person have Mpox.
All right. But what steps can people take to prevent themselves from, getting Mpox?
Okay, the first step is awareness. Get yourself informed. You listen to what is going on around you. We have teams that are carrying out sensitization and awareness creation in all our communities, in all our LGS. So health education is key. The Ministry of Health, using its health education unit and the surveillance team, are carrying out this awareness session, telling people what to see to suspect that this person have Mpox infection. And then another means of preventing it is by personal hygiene. If you must manage Mpox case or suspected case in a health facility, you have to use what we call infection prevention equipment, IPC. So to protect yourself also and to prevent you carrying the infection to another patient. And then we need to wash our hands regularly and frequently using soap under running water. We have to avoid touching, close contact, touching people with suspected infection, shaking of hands, coughing. When you are close to an infected person that is coughing or sneezing, you can pick it through respiratory droplets. So we have to avoid close contact that can give us this infection, that is touching, kissing, or sexual intercourse. Because mostly people that have multiple sex partners or homosexual are at risk of getting this infection. So that is close contact. And then another means of prevention is seeking medical attention. If you have symptoms that align with what we have mentioned, fever, muscle pains, back pains, swollen liver, and then this rash that begin from the face and then spread to other parts, you have to seek medical attention. Report immediately. You can call the surveillance and epidemiology team, and we will link up with you to refer you to a hospital, take your sample, and then test to know what actually is the problem. Then another way to prevent it is vaccination.
All right.
So, yes, vaccination.
Yes, and for vaccine,
though we don't have the vaccine in Nigeria yet, we are expecting it soon.
Yes, Dr. Egbe Ayuk. And I think the federal government just received a generous donation of about 10,000 doses from the U.S. government. Yes.
Okay.
Thank you so much for talking to us about this and about effort also in Cross River State to manage the situation. Dr. Egbe Ayuk is a state epidemiologist. Thank you so much for talking to us.
Thank you very much.